Hi, this is Brian Wormers recording a lecture from Medical Surgical Nursing. Today we're going to be talking about vascular problems and specifically hypertension. So we're going to talk about assessment, identification of hypertension, differences between primary and secondary hypertension. We'll talk about atherosclerosis. We'll talk about nursing diagnosis and care for those patients with hypertension. We'll talk about nursing interventions who have patients who have hypertension, and especially within the older adult. So I don't think this is going to be new to you, but this is a thickening of the arterial wall related to aging or plaque. And so what you're kind of seeing here is a buildup and then narrowing of that vasculature. So arteriosclerosis is thickening the arterial wall. Atherosclerosis is that plaque. So have an understanding between the difference between those two. They're very close. And ultimately what it means is that there's less perfusion. So causes for this: lipids, toxins, aging, disease, genetics, smoke, those kind of situations. Increased weight gain. So progress, usually this is something that goes on for decades of life before manifestations occur. We're seeing this in younger and younger. Patients in their 20s now have got significant atherosclerosis, and of course that's a complication that will just continue to worsen with time, generally speaking. So what happens? So ultimately will result in an emergency situation with myocardial infarct, sudden cardiac death, stroke, or even gangrene if you're getting a lack of perfusion. So as an overview, incidence and prevalence, we're seeing this. You see it very commonly in primary care, but then of course acute care, you're going to see it where it's caused stroke, MIs, cardiac failure, or death. So what does hypertension mean? Well, it used to be if you're 60 years old and older, if your blood pressure was 150, your blood pressure would be greater than 150 over 90, or for people less than 60, it'd be heart rate or blood pressure of 140 over 90. So in 2017, they did revise this a little bit. These are a little older. I think those are 2014 guidelines for what should be normal. So they kind of said what's abnormal here is a threshold of 130 over 80. Anything above that is concerning for hypertension. So for my test, I'll use 130 over 80. So if they've got this, realize that that's, so 145 over 95 is hypertension. So what are some of the mechanisms that influence their blood pressure? Of course, arterial baroreceptors, if you get more squeeze on that because they feel like they are low on body fluids. So if you're low on body fluids, of course, that will work on it too. You get your renin, angiotensin, aldosterone system. You've got vascular autoregulation, trying to maintain pressures. So all this works in collaboration. All of it is cyclic in nature. So that's kind of the primary blood pressure. And so if you've got secondary hypertension, this is caused by another disease state or other drugs that are causing this. So if I was to give you a medication that causes hypertension, that's secondary. You can get malignant hypertension, and this is, as we said, very severe forms of this. So if you've got, systolic over 200 and diastolic over 150, that's something that needs to be addressed rather quickly. Men do have a higher percentage of women, but towards the end of life and in their older, as they gain age, wisdom, and beauty, they tend to have higher rates of hypertension. Also, culture can play a factor with this. African Americans do have a higher prevalence of this compared to Caucasians. So with this, what are we looking for? So we talked about some of those risk factors with age, ethnicity, family history, diet, drugs, and exercise, of course, medical history, so hypertension. So if they've got it, then of course that's easier to see. Kidney disease, so if their kidneys are not working and they're squeezing and trying to get more flow, you're going to see hypertension more. And then cardiac disease or medications that they're on could have secondary effects. So Objective-wise, most often they don't feel bad. You know, if this is low-grade hypertension, they won't have any signs and symptoms. As it progresses, though, they might have headaches, flushing, dizziness, fainting, or nosebleeds. As it really progresses, we're going to see some retinal changes, maybe some renal artery stenosis, and then you're going to maybe see elevation of blood pressure. So psychosocial stress definitely can impact your hypertension and make it worse. Diagnostic-wise, you know, doing your blood pressures is probably the biggest thing that you're doing with this one, but we're looking for other signs and symptoms that are leading into this. So looking at urine studies to make sure that the kidneys are not impacted with your BUN and creatinine. You might look for cardiomegaly, so if your heart's not functioning right, that could cause hypertension as well. And you could look at your EKGs and ECGs to determine cardiac involvement. Planning and implementation, so lots of teaching related to this one. So things that we can try and get them to do would be restrict sodium, reduce weight, use alcohol sparingly, get enough exercise, try some relaxation techniques and meditation, avoid tobacco and caffeine, and of course there are some complementary therapies which garlic and coenzyme Q12 have been used before. Be a little careful with this. They do sometimes have some side effects with clotting, and of course, you know, anything that you put in your body can give you like nausea, vomiting, diarrhea, those kind of situations as well. Other interventions, so drug therapy, so what we can actually use is be diuretics, trying to decrease the amount of fluid that you have in the vasculature. Realize that this could have electrolyte imbalances as it could shift sodium and potassium, as that's often what our diuretics do, and that can impact some glucose control. You can use calcium channel blockers, you can use your ACE inhibitors, or you can use your ARBs as well. So all those are looking at reducing your blood pressure. So things you might see with this one, so if they're on enalapril for the control of hypertension, what are you going to watch for? And the big thing is watching for this nagging cough. It does have a side effect of that. So if they start having that, then of course we're going to switch them on different meds. So the things we want to do is promote adherence to the plan of care. So, you know, things that they want to do is home care, self-management. So taking their medications, providing the education, providing them on resources on when and how to take those medications, and then monitoring at home. So, you know, in-home blood pressure monitoring devices can help out with this. That concludes this very brief and very high-level overview of hypertension. If you have any questions, please feel free to contact me.